This is a lecture on human skeleton by Professor Ali Altimimi. Hello to all students and welcome. The human skeleton formed by 206 bone, including cartilage and ligament, and the skeleton is the framework that provides structure to the rest of the body and facilitate movement. The human skeleton forms of two parts. The first part we call it axial skeleton, and second is appendicular skeleton. نبدأ بالaxial skeleton. Axial skeleton form the longitudinal axis of the body. Components include skull and associated bone, thoracic cage, vertebral columns. These are the axial skeleton, including the supplemented cartilage. بمجموعة it include 80 bone. The axial skeleton have 80 bone. فإذا مجموعة 80 عظم, about 40% of bone in the human body. So the whole skeletal system have 206 bone. This is عدد العظام 206 بكل skeletal system. With the axial skeleton there is 80 bone. With appendicular skeleton there is 126 bone. From the skeletal system, axial skeleton, the skull and associated bone 29, thoracic cage 25, and vertebral columns 26 bone. All these are the axial skeleton. We will concentrate on the skull and associated bone. The skull have 8 bone, which is cranium, 14 face, and auditory ossicles 6 bone. Associated bone is the auditory ossicles and hyoid bones. These are the axial skeleton, the skull bone. Other group in the axial skeleton is the thoracic cage, form of 25 bone, 1 sternum and 24 ribs. Then in the axial skeleton we have vertebral columns, form of 26 bone, vertebrae 24, sacrum 1 and coccyx 1. With regard to axial skeleton function, 1. Support and protect brain, spinal cord and organ in the trunk body cavity. 2. Provide attachment site for certain muscle that adjust position of head, neck and trunk, and perform respiratory movement, stabilize position, part of the appendicular skeleton that support limb. Joint of the skeleton limit in the movement but very strong. The skull has a cranial and facial component that are usually bound together by suture. Skull bone form 22 bones in total, 14 facial bone and 8 cranial bone form the cranium or brain case. 7 associated bone, including 6 auditory bone and located in the temporal bone, 3 on each side, and 1 hyoid bone connected by ligament to inferior cervix of the temporal bone. Your skull form two parts: bone of the face and the cranium. Bone of the face, we have 14 bone: maxilla 2, palatine bones 2, nasal bone 2, inferior nasal concha 2, zygomatic bone 2, lacrimal bone 2, vomer 1, and mandible 1. With regard to the cranium, the cranial bone form 8 bone: occipital 1, parietal bone 2, frontal bone 1, temporal bone 1, sphenoid 1, and ethmoid 1. Associated bone, we have hyoid bone 1, and auditory ossicles includes in the temporal bone 6. These are the components of the bone of the skull. This is a lateral view of the facial bone. In the lateral view, we can see the mandible, the maxillary bone, the zygomatic bone, nasal bone, lacrimal bone, and the vomer. This is in the lateral view of the face. And this is frontal view of the bone of the face. This is the mandible, this is the maxilla, this is the zygomatic bone, and this is the nasal bone. This is the lateral view of the skull. We can see the frontal bone, the parietal bone, the occipital bone, the temporal bone, sphenoid, and ethmoidal bone. And this is a lateral view of the skull. We can see frontal bone, parietal bone, temporal bone, occipital bone, sphenoid, and ethmoidal bone. Other component of the skull, including the suture, and the sutures is a joint or articulation between the skull bone of the adult. We have 4 major sutures: coronal, attached frontal to parietal bone; squamous, attached temporal and parietal bone; sagittal, attached parietal bone; and lambdoid, attached occipital to parietal bone. And this is a lateral view of the skull, and we can see there is a coronal suture. This is a coronal suture, a suture between frontal bone and parietal bone. And there is squamous suture. This is squamous suture, the suture between parietal bone and temporal bone. Then we have lambdoid suture. Lambdoid suture is a suture between occipital, parietal, and temporal. And this is a posterior view of the skull. We can see a sagittal suture, a suture between parietal bone. We have 2 parietal bone, left and right, and between there is a sagittal suture. And we can see also a lambdoid suture. This is a lambdoid suture, the suture between occipital and parietal bone. And this is a review of facial and cranial bone in the anterior view. These are facial bone, including paired bone. These are nasal or paired bone. Lacrimal is a paired bone. Palatine, this is a palatine bone, palatine. Then zygomatic bone, maxilla, inferior nasal concha. Then we have a single bone including the vomer. This is a vomer. Then the mandible is a single bone. With regard to cranial bone, this is the parietal bone, then this is the frontal bone, then this is the sphenoidal bone, and this is the ethmoid bone. Now we have facial and cranial bone in the posterior view. And this is the cranial bones in the posterior view. These are parietal bones. Then this is occipital bone, and this is the temporal bone, and this is a mastoid process, and this is a styloid process. Then this is the mandible, external occipital crest. This is external occipital crest, external occipital protuberance, squamous suture, lambdoid suture, sagittal suture. These are the facial and cranial bone in the posterior view. And these are the skull bone marking bilateral view. This is the forehead, this is the frontal bone, this is the coronal suture, this is the superior and inferior temporal line. Superior and inferior temporal line. This is temporal bone, this is the lambdoid suture, this is the occipital bone, and this is the sigmotic bone, then sphenoid, ethmoid, lacrimal, nasal bone, maxilla, anterior alveolar process, and mastoid process. Then we have styloid process, zygomatic process, mandible, mandibular angle, mental protuberance, alveolar part of the mandible, alveolar process, maxilla, nasal bone, lacrimal bone, ethmoidal bone, sphenoid bone, the forehead. So this is the skull bone marking in the lateral view. And now this is the skull bone marking in the sagittal view. We can see the sphenoid, the frontal bone, the coronal suture, the sphenoid sinus, right sphenoid sinus, the hypophyseal fossa, parietal bone, temporal bone, occipital bone, the internal acoustic meatus, hypoglossal canal, styloid process, mandible, maxilla, palatine bone, vomer bone, conchae, inferior nasal conchae, right, ethmoidal bone, nasal bone, frontal sinuses, sphenoid, frontal bone, and this is the coronal suture. So this is the skull bone marking in the sagittal view. Now we have inferior view of the foramina. Foramina opening in the skull to pass vein, nerve, artery. In the foramina we have foramen lacerum. This is a foramen lacerum. Foramen ovale, and this is a foramen ovale. carotid canal. This is a carotid canal. Stylomastoid foramen, stylomastoid foramen, jugular foramen, foramina magnum, and these are bone. Maxilla, palatine, frontal, zygomatic arch, styloid process, mandibular fossa, occipital condyle, lambdoid suture, inferior and superior, knuckle line, occipital bone, vomer maxilla. So these are foramens and bone in the inferior view. This is a superior view foramen. The هذا section وجاي نشوف superior view. الفورامينا, this is the ethmoid bone, and these are olfactory foramen, and this is sphenoidal bone. We have optic canal. These are optic canal, and foramina rotundum, optic canal and foramina rotundum, and this is foramina ovale, foramina lacerum, and foramina spinosum. Then in the temporal bone we have a carotid canal. These are a carotid canal. Then internal acoustic meatus, Then in the occipital bone we have a jugular foramen and hypoglossal foramen, and there is foramina magnum.